Hi, I'm Sarah from Woodborough House, and I've just got a few tips for you post-surgery if you've had a tooth out, you've had an implant placed, you've had a sinus lift, or you've had some bone grafting done at Woodborough House Dental Practice. So most likely you've had some sedation. There is a separate video for the chaperone that they can watch, and really they're going to look after you on your journey once you get home from Woodborough House. You need your chaperone to come if you're having sedation, because obviously you can't drive home and you can't really be left on your own because you've had a drug and you're sedated. So we do need you to make sure the chaperone will stay with you for the whole day and hopefully that evening as well. When you get home after your appointment, you will be numb. Even though we sedate you, we also give you local anaesthetic, so your mouth and your tongue and your cheeks will be numb. So it's really important to avoid hot food and to avoid anything too crunchy or hard, because you won't be able to feel what's happening. We don't want you to bite your lip or to burn yourself in any way. You will have sometimes been prescribed antibiotics. It's very important that you adhere to the prescription we've given you and take them as prescribed. It's really important you also take the painkillers prescribed to you as prescribed. Depending on if you have any allergies or other medical issues, we will tell you what painkillers we've given you and how to take them. A lot of people stop taking the painkillers because they say, oh, it's been great, I haven't had any pain. But it is really important to keep taking those painkillers because it actually helps with the inflammation as well as the pain. So that means you'll be less swollen. Avoid alcohol and smoking when you get home, and definitely avoid any exercise or strenuous activity. It's really important to set aside 2 or 3 days after the extraction or the surgical appointment so that you really rest up. If you're resting, your body will heal better, and we don't want you doing anything to compromise what we've done for you. Please, as I say, do not look at the surgical side, but if you do happen to notice it, don't poke it, and it will look strange to you. That's completely normal. A lot of patients ring up and say they think it's infected, but when the tissue is healing, the granulation tissue will appear white, which some people think is pus. It's definitely not pus. It's very unusual to get pus in an extraction site. The other thing is we do use plasma. Some of you will have had blood taken, and we use the plasma from the blood and we pop that back into the surgical site. That also appears very white, so some people can mistake that for infection. But please don't be alarmed, it's perfectly normal. Please make sure you do have a soft diet after an extraction or a surgical appointment. This just helps the tissues to be safe and heal well. No rinsing on the day of your extraction or your surgical appointment, because this can disrupt the blood clot and cause bleeding. So please don't rinse your mouth in any way for the first 24 hours. And bleeding is completely normal after an extraction or a surgical procedure. Now, when you put a drop of food colouring into a glass of water, the whole glass will turn red. Think of that the same way with your mouth. A little bit of blood oozing out, mixing with your saliva, will appear that you've got a lot more blood in your mouth than you actually have. A lot of patients can be alarmed by this, particularly if you've been dozing off, sleeping on a pillow, and then you see the blood. So please don't be worried. The only time to worry is if your blood is pouring out of any part of you when you're bleeding, like you've got a tap turned on. So oozing is completely normal. We do give you a lot of packs post-operatively to bite on. So if you have the gauze, just pop it in your mouth, bite down really hard for at least 10 minutes. Don't keep checking, because if you keep checking, then you won't compress the tissues and they won't stop oozing. If you are very worried, then please just give us a call and we'll be happy to chat to you about anything. The next day after you've had the extraction or the surgical appointment, that's when we want you to start rinsing with hot salt mouthwashes. We prefer you to wait 24 hours from your actual appointment, so it's in the afternoon, wait till the following afternoon. Hot salty water is miraculous healer, so you can make that up yourself at home. Cup of tea temperature, and then put a teaspoon of salt into the water, mix it around and make sure it's not very hot. Test it on your hand like you would with the baby's bottle, and then slowly pop it into your mouth and gently rinse it around. We don't want you to be very ferocious with that rinsing, just a very gentle rinse, just to bathe the area of the extraction site or the surgical site in salty water. Ideally, if you do this 5 times a day, that would make us very happy. Now, you may have also been prescribed a medical mouthwash to use. We do have mouthwashes. We have Oracare, which is our new mouthwash. Some people are given Corsadol. Some people may be given a different kind of mouthwash. If you do get given something, please use it as instructed. It's very, very normal after an extraction or a surgical procedure to have some swelling and bruising. This is different in everybody. We do give you a cold compress that you can use on the day post-operatively, and if you run out of that, a bit of ice and a tea towel is a great thing to pop on, just like you would if you've sprained an ankle. Pop it on every now and again to give the area a bit of cold treatment to stop the swelling, but please don't be alarmed about it. Your anti-inflammatories, which is ibuprofen or Nurofen as you may know it, they do really help with the swelling. So if you've been prescribed those, please don't stop taking those, as you'll find that those drugs will also alleviate it. But the most important thing is don't be alarmed. Don't plan any big parties or outings after you've had a surgical or extraction appointment, because obviously you won't be looking your best. Often the swelling and bruising and the pain is worse on day 2. So people often say on day 1 when we ring you, I feel fantastic, it's great, but actually day 2, day 3 you may start to go downhill, but that's perfectly normal, it's just the way the body heals. So just keep taking your painkillers and keep using your cold compresses and keep resting. Really important that you come back for your review appointment if you've been made one. This may be just to look at the surgical site, or it may be to remove sutures. Even though the sutures or stitches we use are resorbable, which means they disappear over time, we still do see you a week later, because those stitches do take a long time to resorb, and we prefer to take them out ourselves so they're not irritating you in any way. If you've had a sinus lift procedure, it's really important you don't blow your nose. Nick will tell you this. And when can you blow your nose again? That's really up to Nick to tell you. So at the review appointment, he will then look and make sure everything's healing nicely, and he will advise you that you can or can't start blowing your nose again. Some patients are concerned if they sneeze after the surgery appointment before Nick says it's okay to blow your nose. There's nothing you can do to stop yourself sneezing. So if that happens, please don't worry. Just let Nick know when you come for your review appointment, but actually things will probably always be okay.